Lesser occipital, greater auricular, transverse cervical. These are supraclavicular branches out of the platysma. Take this off underneath here.
I didn't know they had there.
Spinal accessory nerve. Right here is trapezius with spinal accessory nerve here. And this is our splenius capitis. This is levator scap right here. On top of it rides the spinal accessory nerve. And here we also see our superior belly of the omohyoid, inferior belly of the omohyoid. We also see our anterior scalene, middle scalene, posterior scalene. Riding on top of the anterior scalene is the phrenic nerve. We have our brachial plexus between anterior and middle. So this is C5 nerve root. We count upwards C4, 3, 2, and this again is spinal accessory. You do not see C1 nerve root.
Please do 4, 3, 2 again.
Okay. 5, 4, 3, 2. Okay. Here we have.
Thank you. I put the cables back. Everything's good.
Okay, thank you.
Appreciate it.
Here we have internal jugular riding in between the common carotid here. This is vagus nerve. Right here, this is ansa cervicalis. The nerves that you see pointing to certain things like thyrohyoid, this is the nerve to the thyrohyoid, and this is the nerve to the sternothyroid. It's pretty simple. Here, off of our subclavian artery, we have our suprascapular artery. We have our ascending or transverse cervical artery here. We have our inferior thyroid artery going in this way.
I'm sorry.
Inferior thyroid artery going this way. Off of our common carotid, it splits into external and internal. Internal goes up to the brain. External throws off a branch for superior thyroid, which also sends in a small branch into the to become the superior thyroid artery with the internal superior laryngeal artery.
Hey, can y'all keep it down for 1 sec?
Nerve.
I'm sorry. Say it again, I'm sorry.
Internal laryngeal nerve and superior laryngeal artery.
Okay.
Right over here, right now.
And back here, we'll take this off. This becomes facial nerve.
The one over the bone?
Yeah, this one is facial nerve. And you see it coming in and coming down this way. And then we have ascending pharyngeal. We've got posterior auricular artery. This becomes the buccal artery. This one is our maxillary artery, throwing off middle meningeal, then continuing to be superficial temporal. This, yeah, and this nerve here is our lingual nerve, and this one goes into the jaw to become the inferior alveolar nerve. So that's off of V3. This is trigeminal.
Oh, okay.
Okay.
What's that muscle behind that teeth? Right there, yeah.
Buccinator.
Oh. Really? It's a portion of it cut?
Yeah, it's cut because it would normally be coming around this way.
All right. And then the nerves going to the teeth are, excuse me. Wait, you know what? There's some that goes to the teeth and then some goes to the tongue. So that
This one goes to the teeth. This one goes to the tongue.
And so what are the ones that are
These are inferior alveolar nerves.
Okay, and artery and vein.
Yes.
Okay. That's
Infraorbital
facial.
nerve.
Okay.
This is a continuation of facial artery. Supratrochlear artery and nerve. Supraorbital artery and nerve.
Okay.
Orbicularis oris. Levator palpebra superioris.
I just want to know the veins and arteries because I know we're running out of time. And I forgot I didn't take pictures of the eye. Did we already do everything?
Mhm.
Oh.